Good day, dear participants. You're welcome to this session of the Training of Trainer workshop. And let me thank the organizers of this program for inviting me to speak on these very important subjects, significant event analysis. This is supposed to be more or less a practical session where trainers acquaint themselves with what significant event analysis is, how to guide their residents to conducting significant event analysis, and also how to use it as a form of formative assessment in the training of our residents. But beyond training, also to improve the quality of care delivered to our patients in our respective institutions. So I'll be speaking on significant event analysis. What's the purpose of this discourse? It is to be able to identify events in individual patient management that have been critical. Some of such events might actually be beneficial, while some may be detrimental to the outcome of the patients, with the aim of improving the quality of patient care and also to learn lessons on how to do things better another time. Apart from that, is a way of instigating a culture of openness and reflective learning. You know, many times if you do not create a culture of openness, near misses or even clear errors will be hidden because of fear of punitive measures. But with this type of what I will call auditing what you were doing in an open, reflective environment, knowing that it is not to apportion blame to anybody or for self-criticism. So practicing significant event analysis help to instigate that culture of openness and reflective learning, as well as enabling the team that were involved in the management of that particular patient that had a significant event to be able to build and support themselves to reflect on what happened and, of course, remove the stressful events or the stress felt after such a stressful episode. Apart from that, is to enable identification of good as well as suboptimal practices. What went well? How did it go well? What didn't go well? What happened that didn't go well? How can it be improved in the future? So that gives a very practical opportunity to be able to identify all those things that happened in the heat of the moment when things are happening. We need to come back and reflect on what did we do well? What didn't we do well? How can we improve on it in the future? So significant event analysis helps to do that, as well as to provide a useful tool for team and individual continuing professional development. It's when you reflect on what you have done, see where you can improve, and improve on it when such events or such occasion arises in the future. That is what helps us to continually improve not only our knowledge and our skill, but even our attitude in patient care. And we're able to identify the needs of the trainee, and we use the opportunity either to teach or to guide, and also to provide instructions on how to be better in the future, as well as commending the things that were done well and boosting the morale of the trainee to be able to continue to improve in their practice. It also helps to share between interdisciplinary patient care teams where such events, mostly adverse events, occur at the overlap or in shared domains of clinical responsibility. So when you are talking of a multidisciplinary approach, and in that in that interplay or overlap or shared domain of that interdisciplinary approach to care, there may be a lot of lessons for the various teams to learn for future collaborative patient care. So when we're looking at significant event analysis, it's actually a way of doing root cause analysis of what happened. And of course, for a root cause analysis, you want to ask questions. So the first question is, what happened? Especially if it's a good thing or it's something that's not so good. And why did that happen? Then, how could things have been done differently? What can we learn from what happened? And what can we do differently? What change needs to take place? And it provides documented evidence for even the management to be able to put in place administrative as well as systemic processes that will help to forestall such events and continually improve practice in that particular institution. So this is a typical form that needs to be filled when we're doing significant event analysis. And these forms are available in our online e-learning platform, Evidemi. So the first page of the form, you have to fill, the resident fills the date of that event, the description of what actually occurred, and what was it that was managed well or done well, and what was it that didn't go quite well, and then identified what the problem was. And then on page 2, you have this fish diagram. It's called fishbone diagram or Ishikawa diagram. It is just a way of representing the problem and also the root cause of the problem, or the effects and the cause that led to that effect. So this is the fish head. That's where the problem is. Usually it's written in a question format. Why did this happen? Then this is the backbone of the fish, and you have, the other bones that comes from that backbone forming this whole skeleton of the body of the fish. These are the various reasons why the problem occurred or that led to the problem. And in many cases, all those problems are identified by a team, preferably the team that managed the patient. They brainstorm, they come up with multiple causes of the problem. They now group that problem into various categories. So at the end of the day, it goes into this backbone, which now leads to the effect or the problem that was observed. And then you want to find out what the main lesson, that should be identified, the main lessons that is learned during that particular event, and what action needs to take place. Who needs to take that action to prevent such event from happening, or if it's a good event, to continue to promote such events, and when will such action be taken? And for the purpose of formative assessment for residency, the trainee that is a significant member of the team that managed the patient will be the one to fill this, document it, and allow the trainer, the supervisor, to see what has been filled, and also to be able to now sign that that particular resident had carried out significant event analysis as part of the formative assessment for training. Usually the residents will present such to the supervisor, who will now ask further questions, discover areas where there are gaps in practice, knowledge, or attitude, and help, to improve the outcome for the particular resident. So this is just, I will call it template for the Ishikawa diagram. So again, here you see the fish head, that's where the problem is. And then you see the skeleton of the body of the fish. You have all these, space holders for the various causes of that problem. So at the end of the brainstorming session, the various causes are grouped into those that look similar or under one umbrella, and then you have the major categories or the major causes of the problem. So in this way, the team is able to discover why the problem occurred with the aim of knowing how to solve the problem. The available materials for references, videos for references, materials that can be downloaded at www.evidemi.com. Under the orientation package, the very last module there talks about how to use the formative assessment material. And one of the video focuses on the significant event analysis. And the form that needs to be filled are also downloadable on the membership and fellowship module e-portfolio. All right, so when we say root cause analysis, to summarize, you identify the problem, that's the fish head. This is best done by a team involved in managing the patient. Then the team brainstorm to identify the causes of the problem by asking why exhaustively, and then categorization of those causes are done. Usually there are different ways of categorizing. You can say based on the systems, those that fall under supplies, those that fall under surroundings, or those that fall under, the skill that is required. So the team, they brainstorm, they agree on what category that particular identified problem it's on. So let's go into a session with one of my residents who did significant event analysis. Happy listening. Over to you, Dr. Sadebe.
Good day all. I will be demonstrating how to fill a significant event analysis form today. So this is the form. It has several components, which includes a description of the occurrence, the dates the event occurred, what was managed well, what did not go well, the fishbone, which shows us the problems and identifying the causes of these problems, identification of main learning needs, actions to be taken, as well as by whom and when. So in demonstrating this, we're going to be using a case scenario. So we have a 35, this event occurred on the 17th of June, 2024. It involved a 35-year-old female, she's a medical doctor, a known asthmatic, who was rushed into the accident and emergency on account of cough of 4 days duration, breathlessness, and wheezing of 1 day duration. On examination, she was in respiratory distress with a temperature of 38 degrees centigrade. Her chest examination revealed widespread rhonchi with coarse crepitations in the right middle and lower lung zones. On assessment, an assessment of acute asthmatic attack precipitated by community-acquired pneumonia was made. She was to be nebulized with Pulmicort and salbutamol nebules, but none of these were available in the accident and emergency pharmacy. Patient relatives had to go out of the hospital to purchase the medications, leading to delay in the patient's care and deterioration of the patient's condition. So what went well? What was managed well? Admission was prompt and investigations were requested for and carried out. Patient had IV hydrocortisone given and also placed on intranasal oxygen. What did not go well? So the asthmatic attack could not be abated promptly because of unavailability of nebulized Pulmicort and salbutamol, leading to delay in the treatment of this patient. So now for the fishbone. The fishbone includes the head, which is the problem, usually a question, why? So for the problem, why is salbutamol nebules not available in the accident and emergency? So that is the problem. So you have the back of the bone, which gives us the reasons why this problem occurred. So after brainstorming, we're able to find out 7 reasons why this occurred, and we grouped them into 3 different headings. So the first one is the process. Salbutamol labels were not available in accident and emergency. Why? Because there was no emergency tray. There were no salbutamol labels. Then another group was the supply. There was no supply from the pharmacy. So the emergency tray couldn't get the emergency drugs, which were the nebulized salbutamol and Pulmicort. Why was there no supply from the pharmacy? Because of the out of stock syndrome. So the third heading is the system. Under that, we found that salbutamol was not made available because they were awaiting management approval. And why were they awaiting management approval? Because of the bureaucratic bottleneck that was delaying this approval. So this is what the fishbone is all about. So in identification of the main learning needs, 4 different learning needs were identified. This includes the first one: anybody can be a patient, including the doctors, and therefore all health workers must ensure quality service delivery. The second one is importance of having a standard emergency tray in the accident and emergency. The third one is the effect of bureaucratic bottleneck on healthcare delivery. And the fourth is the dangers of out-of-stock syndrome. Now, what actions can be taken? It includes daily maintenance of the emergency tray, which will be carried out by the senior registrar and the matron in charge of the accident and emergency, to enable them to know which drugs have been used and how to replenish them immediately. So this will be carried out daily. So for the second action, we have prompt release of funds for emergency medications. This will be carried out by the management and should be done as soon as possible. The third one is the prevention of out-of-stock syndrome for emergency medications. This will be carried out by the HOD pharmacy, and this will be carried out as soon as possible. Thank you.
All right. Thank you, Dr. Sadebe. So after she did the significant event analysis, she presented that as part of her formative assessment. So let us see how she did presenting a significant event analysis documentation. So Dr. Sadebe, over to you.
All right, you're welcome.
Thank you very much, sir.
I know you are here in my office this morning for formative assessment.
Yes, sir.
All right, and from the mentorship program, you are supposed to have assessments on significant event analysis. Am I correct?
Yes, sir.
All right, good. So, do you want to be very comfortable? Are you okay like that?
Yes, I'm very much comfortable. Thank you, sir.
Okay, so you're welcome. All right. I know you've been doing a lot of hard work as resident doctor, and you see a lot of events. So, which one do you want to report on today for your formative assessment?
Okay, I'm going to just quickly summarize on one. It's about a patient that was seen on the 17th of June 2024. It was a 35-year-old non-asthmatic. A female medical doctor was rushed into the accident and emergency on account of cough, difficulty in breathing, and wheezing. So after examination, she was found to be in respiratory distress with temperature of 38 degrees centigrade, with widespread bronchi as well as crepitations in the right lower and middle lung zones. So an assessment of acute asthmatic attack prescribed by community-acquired pneumonia was made, and she was meant to be nebulized with nebulized salbutamol and Pulmicort. But she didn't get this nebulization because of lack of availability of the nebules in the accident and emergency pharmacy.
Oh, that must have been a significant event then.
Yes, it was really significant.
Okay, so did this patient make it at the end of the day?
Yes, after everything, he was able to make it because patient relatives had to go outside to search for these medications from other pharmacies. And he was brought back and the patient was nebulized and was well.
Okay, let me get you very well. Was this patient a non-asthmatic?
A non-asthmatic patient, sir.
Oh, I see. Yeah. And was brought to accident and emergency? Okay. Now, this emergency medication that was not available was the main problem.
Yes,
is that true?
Yes, sir.
Okay. How were you able to use that fishbone? By the way, fishbone, do you know another name for this fishbone analysis?
Yes, it's called Ishikaya diagram. You can use the Ishikaya diagram for it.
Ishikawa
diagram. Yes.
Correct. That's very good. So I want you to show me the Ishikawa diagram and just show me how you were able to use it for the root cause analysis of why those emergency medication were not available. You want to show me that?
Yes, sir.
All right, let's see.
So this is a fishbone analysis. It's also called the Ishikawa diagram. It involves the head, which is the major problem. Why did all the problem happen? And these are the reasons. The backbone shows the reasons that led to the problems. So the major problem that occurred was, why is salbutamol nables not available in accident and emergency? Because that was the major problem, lack of availability of the nables. So we're able to find out 7 reasons why this occurred, and then we grouped them into 3 different headings. The first one was the process. There was no emergency tray in the accident and emergency.
I see.
And that is really very important. And another thing was that because there was no emergency tray, there was no salbutamol nables found in the emergency tray at all, since there was no emergency tray.
Okay.
So under supply, we found out that there was no supply to the pharmacy from the pharmacy. So because of lack of supply from the pharmacy, the emergency tray could not be filled with emergency salbutamol nables. And then another thing was there was no supply to the pharmacy because it was out of stock.
I see.
So under systems, we found out that they were waiting, these medications were already written for, but they were waiting management approval for this requisition for the medications, these emergency medications.
Right.
And what was causing this delay, why were they waiting for the approval, was because of bureaucratic bottlenecks, because of the different stages that they had to go through and different signatures to it before the procurement of these emergency medications.
Oh, that's very good. So I can see that you use this Ishikawa diagram to ask questions and arrive at the root cause. So at the end of the day, can you tell me what was one important action or activity that needed to happen to address this root cause?
Okay, so for the action, we decided a daily maintenance of this emergency tray will be very important. So the accident and emergency...
Wasn't that like usual practice in your center?
No, it wasn't usually done.
So you are recommending that every day, who is going to be responsible for that?
So it will be carried out by the senior registrar in charge of the accident and emergency, as well as the matron in charge. So that when they will come together, they will form a team, they will know who checks what at what time. So that even if one person can't do it, the second person will be available to do it. So that the amount of drugs used can be noted and replaced as they are being used.
Okay, so what I think you need to recommend is an SOP, a standard operating procedure for the management of emergency drugs in A&E. Because it's not just salbutamol nables, it can be any other emergency intervention. So if there is an SOP, that will indicate what needs to be done by who, and somebody will be monitoring that from time to time, like you suggested, the senior residents there or the matron there, to prevent such a thing from happening. How did you feel after feeling this from reporting this event and the actions taken? By the way, I hope these actions have been taken now.
Yes, sir, they've been taken now.
Oh, that's very good. So how did you feel at the end of the whole thing?
Yes, I felt very happy that I was able to identify the problem. And then I was able to follow up the problem, find out the root causes, and actually even find a solution to it, which was carried out.
And of course, if you continue to do this, you will continually improve quality care and service. Yes. And this is the benefit of formative assessment, not just for your training, but for quality service delivery. Yes. All right, so next month again, we're going to have another formative assessment. Yes. I do hope you will do very well. Yes, so if you have to score yourself on a scale of 1 to 10, 10 means excellent, One means, oh no, how will you score yourself? Just your own feedback on your performance. How will you score yourself?
I'll score myself a 7.
All right, so you must be a generous resident doctor. All right, so I will give you the official feedback,
Okay, sir.
and but I want to say that you did very well.
Thank you very much, sir.
I will give the official feedback to the HOD and also the training coordinator, the coordinator of training, so that that can be put in your assessment file and also in your e-portfolio of learning. All right, enjoy the remaining part of the day.
Thank you very much, sir.
Thank you.
Yes, sir.
All right.
All right, thank you very much. So there we have seen the resident doctor presenting activity for formative assessment. We know that significant event analysis is not mainly for assessments, it's for improvements. However, for our residents in training, that improvement becomes part of the assessment. And how do we do it? As you look at these assessment sheets, which is expected to be filled by the trainers, the supervisors, as well as head of department, you will see the portion highlighted in yellow, significant event analysis. This is a yearly form. You will see that the residents should have done 2 at the end of a year. Of course, there are other assessments, but I'm focusing on significant event analysis. And you can see the scoring. Average score should be over 10. In this case, the residents scored herself 7. So the trainer will now put the score in this form, submit to the coordinator of training and the head of department, and will be archived in the residents' portfolio of learning. And when it comes to the time of final defense, the assessors or the examiners can see what the resident has done over the years of training. In this way, training has become the focus, not just examination. All right. We're going to now take questions and answers. And after the question and answer, we will be rounding up. So thank you very much for your attention. And the stage is now set for question and answer. Thank you.